So you may be wondering, what is the mystery behind an addiction? Why is an addiction so difficult to break out of it? Why do people suffer from addiction even while they actually see an imminent death? They keep on with the use of maybe a substance they are addicted to or that particular habit. So on this very video, we'll be taking on the concept of addiction. For the sake of not keeping us too long on a particular video, I would like to also inform us that in subsequent videos, we'll be talking about things such as the consequences of an addiction, the signs and symptoms to be on the lookout for, as well as how to deal with an addiction. For this very one, we want to just explore around addiction generally. So first of all, what is an addiction? Addiction can be seen as a chronic disease that involves a compulsive seeking and use of a substance despite adverse consequence. An addiction can also be seen as a repetitive, constant, and behavioral pattern of using a particular substance or involving a particular habit that is actually posing either health consequence, social consequence, or psychological consequence. And in spite of this, the individual still keeps on with that very behavior. So at that point where you see this very chain, an addiction have actually set in. So we have different forms of addiction, but before we go into them, there are some terms we need to define. This term will guide us. So while discussing an addiction, you'll actually be able to grab some things out of it. First of all, we talk about the substance abuse. What is substance abuse? Substance abuse is a pattern of behavior involving the use of a substance in a way that it is harmful to yourself and other persons. That repetitive behavior of using a substance or a substance in a way that it is harmful to you, the user. So the second one we need to consider is the aspect of substance dependence. This is the physical or psychological reliance on a substance which is characterized by tolerance, withdrawal, and compulsive use. So we say dependence have stepped in when you have the aspect of physical reliance on that habit or there's physical reliance on the substance. And then there's also a psychological reliance on it. It is characterized by tolerance, characterized by withdrawal, as well as compulsive use. Next term to define is the aspect of addiction. What is an addiction? As we said earlier, is that chronic disease that involve the compulsive seeking and use of a substance or that particular behavior despite its adverse consequence. So we'll talk about misuse. Misuse has to do with using a substance for a purpose other than what it was intended for, either medically or socially. The next one we'll talk about is the harmful use. Harmful use has to do with the pattern of use causing physical or psychological harm to oneself or others. Next is psychoactive substance. Psychoactive substances are chemical substances that affect the normal functioning of the brain that will lead to changes in mood, thinking, or behavior. Any chemical substance that is capable of altering your mood, thinking, and behavior can be classified as psychoactive substances. Intoxication has to do with that temporary state of physical or mental impairment which is due to the use of a substance. Withdrawal can be seen as that symptoms that occur when substance use is stopped or reduced. So whenever that particular chemical substance has been withdrawn from the system of that individual, he or she displays some symptoms. Those symptoms can be classified as withdrawal symptoms. Okay? So tolerance, which is the next one. Tolerance is that need, that cravings to increase the amount of substance to achieve the same effect. So let's say you were using one, 1 gram of paracetamol to cure your headache. The point where 1 gram of paracetamol is no longer working for you, but you need to take as much as, let's say, 4 gram of the same paracetamol to get the same effect that 1 gram will do for you. Tolerance have actually set in. So someone will want to ask me at this point, what is the difference between tolerance and dependence? Dependence is that point where both physically and psychologically you need this very substance to function well. Without it, you will not function. Yeah, that point is dependence. But tolerance is when you need a higher dose to get the same effect you were getting. While withdrawal, for those persons who are actually suffering from addiction, they want to ask, okay, what about withdrawal? Withdrawal actually, or withdrawal symptoms, are those symptoms you would display when you are no longer using those substances. That's maybe the first 2 weeks. The next one has to do with relapse. What's actually a relapse? Relapse is a return to substance use after a period of abstinence. After you have quit using a particular substance within a particular time frame, then you return back to the use of that substance. Relapse have actually set in. Okay? So, what we'll actually look at, which is the last one, is substance abuse. It is referred to that harmful or hazardous use of psychoactive substance, which includes alcohol and other routine medications or drugs. Okay, that is substance use. So substance use, it goes beyond just the normal substance we know, or in terms of drugs, the street drugs. It also include the routine medication, over-the-counter drugs that we use. Exactly. Having said this, all right, there are actually different forms or types of addiction. Yes. So what are those different types of addiction? First of all, we can classify addiction into as much as 10 different forms of addiction. Yeah, addiction itself can be classified into 10 different forms. So first of all, we'll talk about the substance addiction, which we have defined. All right, the use of harmful use of a substance. All right, that will actually cause harm to the user. That harmful use of a substance is actually substance addiction. All right. So we have different forms of substance, as I earlier mentioned. One has to do with alcoholism, drug addiction, nicotine addiction, prescription medication addiction, which is the over-the-counter drugs. All right. So when someone abuses alcohol, or use the normal drugs which abuses those drugs, cocaine, cannabis, opioids, then nicotine addiction, or maybe over-the-counter drugs such as petidine, pentazocine, tramadol, and so on. They are classified under substance addiction. Yes, any point you use any of these, it's classified under substance addiction. We also have the second one, which has to do with behavioral addictions. Behavioral addictions, they include gambling disorder, internet addiction, social media addiction, video game addiction, shopping addiction, sex addiction, food addiction. So you must have heard a couple of them, and maybe you may have even find yourself that you are doing some of these things. For instance, well, we all know that gambling generally is an addiction. So we don't need to contest much on that, right? Yeah. So for the internet addiction, this one is another name for it is screen addiction, where you're constantly on your phone. Constantly on your phone. Yes, it is an addiction. Now we also have social media addiction. This one, you for the screen addiction, maybe because maybe it's always in a quest to search for something, want to get particular information, research, and so on, study. That is under internet addiction, which our Yahoo people, sorry for using this word, so the Yahoo can be classified here. Then social media addiction, we're in that one is for the social media platforms. Yes, it is actually an addiction and would need a rehabilitation. The next one has to do with video game addiction. In this particular one, the individual is, for those days, let's say the past 10 years, there was what we call Super Mario, for instance. Yes, or Catrix. Now, those ones you have, it's not like a phone, but it was made in shape of a phone. You can be carrying it around. those things, that very form of video games can become an addiction. Yeah. Whether you have it even in your phone too, you are playing it. For instance, we have people that are addicted to Candy Crush game. So it's an addiction. Now, we have the shopping addiction. Yeah. In this shopping addiction, the individual is used to, he must always go out to get things. A crave for, you can't resist, always wanting to go out for shopping. So we have sex addiction. The individual cannot go even as bad as few hours without sex. So it's an addiction and needs rehabilitation. We have food addiction. If you have heard of the word bulimia before, yeah, this individual always preoccupied with eating food. So we have process addiction. Now, in this process addiction, they include workaholism. People that are always, you must find them doing one thing or other, especially jobs. Yeah, this is where it comes in well. Especially jobs, one thing or the other, they are always preoccupied with doing it. It is a form of addiction under process addiction, right? So we have exercise addiction. There are people that are also addicted to exercise. If they go a day without exercise, it looks like something is missing. It's an addiction. Of codependency. There are people that they depend on other people. They can't function on their own. Exactly. So we have enabling addiction. There are people that they actually aid other persons to commit evil or atrocity. They are addicted to it. They don't feel okay. They don't feel all right, except they assist people to actually carry out a particular thing. Mostly those things that are not good at all. While personality-based addiction, such as the narcissistic personality disorder, we have the borderline personality disorder. In these forms, mostly you find those kind of persons that always crave for attention. Where they don't get it, they don't feel all right. So it's a form of addiction. We have dual diagnosis. All right. In this form, it has to do with where the individual have either substance use disorder or the normal mental illness, and can also come in form of multiple diagnosis where the individual will have a medical condition, substance use disorder, and then we also have the medical illness. We have the cross addictions, switching from one form of addiction or one form of substances to a particular, others to another behavior. You see this individual, you are trying to save him from one, it's onto another one. It's a form of addiction called cross addictions. So we have recovery addiction, all right? Now, in this form of addiction, the individual are becoming overly dependent on the recovery support groups or programs. Yeah, in recovery, there's what we call, which I'll talk about in the different clips. All right. There's what we call support system. These are persons that are supposed to aid the individual in his recovery. But in this case, the individual is dependent on them. He sees his or herself incapable to go on with their life. So in making every daily life decision, he or she depends on these people to do so. So that form of addiction is called recovery addiction. We have trauma-based addiction, such as those persons using substance or going to a particular behavior just to cope with a uh, past memory, mostly the bad memories. All right. So let's say the individual lost a relative, or was raped, or witnessed crime, or was in a place where there was crisis. So he or she will not have the flashback of these very memories. He or she wants to use substances to block that very flashback. So that form of addiction is called trauma-based addiction. We also have what we call social media addiction. In social media addiction is the form where the individual is always wanting to actually form bonds or interact with other persons on social media platforms. It comes under the social addictions. Yes, it comes under social addiction. The individual is addicted to social interactions or relationship. This kind of person, you will say, you talk no dey tire you. You get the individual 1 minute is always wanting to talk with someone. If he doesn't, if he or she Some person will call that kind of person parrot. Yeah, it's a form of addiction. So we have technology addictions, which we have the smartphone. This usually is addicted to smartphones, computers, and other digital devices. Having said all this, if you have found any form of this addiction displayed either yourself, someone close to you, or you have heard about it somewhere, let me know in the comment box, and then we can see how to yes, get to discuss over it. So having watched to this very point, I want to appreciate everyone. Thank you so much, and God bless you.